Dr. Kevin Kavanagh, he is a retired physician. He is also founder of a national organization called Health Watch USA. We call him Dr. K around here. Dr. K, good morning, sir.
Good morning, Jack.
Can I tell on you?
Well, I guess, but it's the full moon. That'll be my excuse.
You just do stuff like that to make me feel better, I'll tell you. Right at 8:30, right at 8:30, the stroke of 8:30 exactly. We got a call. He said, yeah, it's Kevin. Okay, yeah, Kevin, what's up? I'm calling in to do the show. Like in an hour, maybe? Yeah, but you are in a different time zone, aren't you?
No, same time zone, but I had to get a doctor's appointment Central Time yesterday, so maybe that was it.
Okay.
I could maybe use that as an excuse. Who knows?
I'm the last person in the world that should give anybody any crap about doing stuff like that. I do it every day. I think that's why I enjoyed it so much. How are you recuperating?
I'm doing very well. I had a good doctor's report, and I'm starting to get kind of bodily functions under control. Every week's a little bit better, but having surgery for prostate cancer is a significant problem. Maybe someday, if COVID goes away, we can do a show on that, because it's not talked about much, very common in people who are over the age of 60. In fact, I think about 80% of those who are 80 years of age and older develop the problem, and it's something that men have to deal with.
Yeah. Just to give you a little historical perspective, Dr. Kavanagh was a monthly guest on the program for a long time before COVID. And then when COVID hit, we knew we needed an expert on the air as often as we could get him. So I approached you, Kevin, to see if you would be willing to do a 3-day-a-week feature earlier in the morning to keep us up to speed on what's going on. Would we say 6 weeks tops?
Yeah, one time it was like 2 weeks. And I said, no, I think it's going to be longer than that.
Yeah. Well, here we are, going on 2 years later. And this is still going on. Is there light at the end of the tunnel?
Well, I don't think so as far as this virus going away. I mean, it's firmly into a lot of the animal hosts, including white-tailed deer. And as you can see, we're just getting wave after wave after wave. It's not like other types of viral infections. If you compare it to smallpox was a DNA virus, didn't mutate that much, would come in, have a 30% fatality rate. Other people develop lasting immunity. So you kind of paid for everything at one time. This viral infection is more like compound interest. It keeps coming back, and every time it wreaks a little havoc on the society, but it keeps coming back and back and back. And so we really do need to learn how to live with it. That doesn't mean ignoring it. It means changing the way that we do things. That's going to be very important in the future.
Well, this morning we got information regarding restrictions on unvaccinated folks that are filling up our hospitals now, causing, rise in prices. Healthcare costs, just like everything else, are also rising.
Well, that's correct. And some countries are starting to crack down on this. Singapore, for example, is going to cut back on payment for people who are voluntarily or willingly non-vaccinated, and they're not going to have their health care paid for by the state anymore. And as you know, Medicare's premiums and deductibles for Part B are going up over 14.5%. So I think we're going to have to really talk about what social responsibility is, and the fact that we cannot keep going through this year after year. People are going to have to get the boosters. They're going to have to become vaccinated, and they're going to have to follow public health advice. That's including wearing masks, or we're not going to be able to get control of this pandemic and get prices under control and get it so our hospitals aren't being filled and we're not losing so many Kentuckians every day. We need to really get this pandemic under control.
And day before yesterday, I believe it was, the governor announced that boosters have been approved for everybody in Kentucky age 18 and over, right?
That's correct. And I think that was a very wise thing to do. I would have preferred to have that done back in August. Israel started giving boosters out to 60 and above in July 30th. And by the end of August, those that were 12 years of age and older could qualify for boosters. And that's because immunity to this vaccine is waning, especially after 2 doses. And it's probably going to have to be a 3-dose vaccine. So far in Kentucky, we only have about 10% of our population who have gotten boosters. And that's really worrisome, because if you look at some highly vaccinated areas of the world, and this would include Gibraltar, it would include Ireland and Iceland, where 90% plus of adults are vaccinated, they are undergoing huge surges in COVID-19. And this is felt to be due to waning immunity, because they were one of the first areas to get vaccinated. And unfortunately, they've been very slow in rolling out their program for boosters. And so their population is susceptible. And that also includes if you've had a previous infection. There's been new research out showing that if you had a mild infection of the wild type of virus, don't expect to have much protection against the Delta strain a year later. So everybody needs to get a booster to try to boost your immunity for this Delta strain. I think that is very important.
Let's go to this is Mike. Hey, Mike, good morning.
So I have a question for the doctor. So are we supposed to get a booster every year from now to the end of time?
Well, they don't know. I'm kind of on the optimistic side that this 3rd booster is going to last longer. And the reason is this, is that if you look at the data, the people that got the booster had less side effects than the 2nd dosage, which is good, with one exception. That's local lymphadenopathy. 5% of the individuals developed that. And that's a sign that you're now getting a more lasting and prolonged immunological response. So it can go in 2 directions. One is you may need to have a booster every 6 months, every year, or this may be like a 3-course vaccine where you're done with it. And many vaccines are 3 courses.
Laura, you're on with Dr. K. Good morning.
Good morning, Jack. Good morning, Doctor. Listen, I heard something, and I can't remember where it was. People coming out of the military, corpsmen maybe, that want to get into, say, nursing or medicine, are having trouble because their credentials don't, whatever they have, don't transfer, or mostly it's experience. Is there some way not to waste those people? My older sister, now this was back in the 60s, went through a nursing program in Cleveland. I think it was traditional at the time, a 3-year program where the hospitals actually did a lot of training the people, and they were just bused to the college for the book learning part. And she said that later on in her career that those girls coming out of the 3-year colleges hit the floor knowing what to do with the patients. They had a little bit less of the book learning stuff. I went, when I was in my 40s, to a 2-year program for nursing, which I never finished because I never felt like I knew what I was doing. And several times a semester, I would have the highest grade in the class. And it somehow it just, the experience wasn't there.
Laura, I'm just about out of time. We've got less than a minute. Let me get his comment on that. I'll let you listen off. Go ahead there, Kevin.
Well, yes. I mean, we have severe staffing shortages in Kentucky, and the boards have been very active looking at making exceptions, trying to get in out-of-state people to streamline credentialing processes, and also to reactivate those that have been retired. And so the boards are really looking at that, and that is an issue that I think it should be at the forefront of what their priorities are. And believe me, that has been done in the past, and I think it will be done in the future in Kentucky also.
Monoclonal antibodies in our last little segment helping breakthrough infections, is that right?
That's correct. There's over 77% efficacy giving monoclonal antibodies to someone who's had a breakthrough infection. That's an infection after you've had a vaccination. And of course, with the waning immunity, if you didn't have a booster, if you get COVID-19, you may get a significant infection. So please see about getting monoclonal antibodies. That may significantly lessen your chances of being hospitalized or dying of the disease.
And what's the latest on mask wearing?
Well, large study again confirms that masks decrease your chances of getting COVID-19 by 53%. It's just a layer of armor. 50% isn't enough for me to not be vaccinated or take other precautions, but it sure is better than nothing, and that's why I wear a mask religiously.
Hope you have a great weekend. We appreciate you being with us. Thank you.
All right. Thank you, sir.